So if you look at a cranium in a baby's cranium, just like when you look at a spine, underneath this structure is the dural system and is the brain. The brain is a very sensitive organ. It's made up of nerves and it has pathways. Distortion, just like if you think of a spine, people think of chiropractic as a vertebrae moving out of place, putting pressure on the nerve and disrupting the way that nerve transmits impulses. Well, if the cranium is very distorted, the tissue underneath it, the dural tissue, can put abnormal pressure on the brain. It can also reduce cerebrospinal fluid movement, and cerebrospinal fluid is basically the lifeblood of the central nervous system. It brings nutrients to the brain, it reduces waste products, all right, and it helps facilitate the exchange of nutrients and also waste matter and also temperature gradients. So what we're looking at here is when the cranium distorts too much, it can affect tension on that dural meningeal system, the flow of cerebrospinal fluid, and when it affects those tension membranes, they also, remember, as you said, they attach to the nerves as well, the epineural nerve. They can then traction and impede the nervous ability to transmit impulses. So when we talk about craniofacial distortions, though they are very common, they are not always normal, and the degree of distortion, just like the degree of misalignment in the spine, can affect more nerves at a higher level and more intensity. So the worse the distortion pattern, often the higher propensity there is for actually neurological dysfunction to be occurring underneath it.